Hi, Reem Gibson here. Today we're going to be performing the Gtube checkoff video. So I'm going to start with my Coeep. I'm going to check the orders and check my patient's allergies. I'm going to assess the patient and assemble my supplies. I'm going to wash my hands and don gloves. I'm going to identify myself and identify the patient using 2 identifiers. I'm going to provide for privacy, and then I'm going to educate, explain, and evaluate. So the first thing that I want to do is I want to assess for a replaceable tube. And then if I find that it is replaceable, I'm going to obtain an order for it, including the type and size of the tubing. So once I have the order, what I'm going to do is stop the feeding. Then according to facilities policy, each place kind of has a different amount of time that you are supposed to wait before you're able to lay a patient in the supine position after stopping the feeding. So I'm going to wait however long the facility calls for. And then I'm going to put on gloves. So first I'm going to deflate the balloon and remove the tubing. So we deflated the balloon, and then we're just going to remove. Now this is just a Foley catheter tubing, but once I've removed it, I am going to discard of this either in the biohazard bin or whatever the facility calls for. So we're just going to discard, remove our gloves. Then we're going to put on a clean pair of gloves because next we're going to assess the site and make sure that we clean it according to the facility's policy. So after we've cleaned it, one thing I forgot to say, whenever I'm removing the tubing, if I meet any resistance, I'm going to make sure that I stop and notify the physician before I continue doing so. So we're going to pretend like this is a new tubing, and I only have one. So this is our new clean tubing. So just like a Foley catheter, we're going to make sure that we lubricate this before we insert. So we've lubricated. And before I begin, I'm going to go ahead and open my new flush. That way I don't have to take one hand off of the tubing after I've inserted it to just make sure that it doesn't get pulled back out. So we're going to go ahead and open our new flush. And I'm going to go ahead and connect it. Okay, so we've lubricated, and then we're going to insert 2 to 4 inches, and then we're going to inflate our balloon. So we're going to insert 2 to 4. Then I'm going to make sure I hold it in place with this hand over here, like I said, to make sure it doesn't get pulled back out. And we're going to inflate. So we just want to make sure that the balloon is inflated by tugging on it just a little bit to make sure that it's not coming out, and then slightly advance it forward just like we would with the Foley. And then after we've done that, we're going to place an external bolster if applicable. So discard. So next what we're going to do is we're going to check our placement. The way we're going to do that is we're going to connect our irrigation thing, and we're going to aspirate some of the gastric content. So after we've aspirated, and we're going to take litmus paper and we're going to check the pH with the litmus paper, and we want our content pH to be 4 or less. So once we've done that, we've checked it, everything looks good. Then now we've got 30 milliliters of sterile water. So then we're going to insert that. And with the stomach content that we aspirated, some facilities have you throw it away, some have you place it back into the stomach. So we would just make sure that we follow those facility guidelines as to what we do with what we've got in our return. Okay, so we've instilled our 30 milliliters. Take off our gloves. after we've done that, we are either going to plug it or connect it back to the feeding, whatever the orders are for. And then we're just going to document how the procedure went, if there was anything abnormal, things like that. So thank you.